Hey, worked first time. That never happens. Hi, welcome to Mad Medicine with Miss P. And to have some more Mad Medicine for you today because you just you can't make this stuff up. And I am going to get to the student stuff. We'll do that too. A couple quick things from this week already. I want to say this may have been all from yesterday. Um, a patient told me in her list of surgeries that she had a breast replacement. I'm like, and in her defense, this is kind of a breast replacement. If you've ever seen a tram flap, it's pretty amazing. I worked with a surgeon years ago who did a breast replacement. I mean, that's not what we called it, but it is amazing. It is literally replacing your breast with your own tissue and creating the same slope and the same angles, and I mean all but identical breasts. I saw this surgeon do. It was amazing. So you kind of get a tummy tuck out of it. I still don't even completely understand. It seems insane to me. Whoever made this up blows my mind. You tunnel up the tissue from the abdomen up to create a breast, so you end up kind of getting a tummy tuck and breast with your own tissue to not have to deal with implants, which I thought was amazing. The kicker there is that she, I guess, later found out that it was actually not cancer she had and didn't require this surgery at all, according to her. That was pretty wild. Oh, another patient told me that they were coming in for a shoulder surgery. So I was like, okay, I'm looking for the day that she says her surgery's on. I say, who's your doctor? And then after she tells me her doctor, that's who's not a surgeon at all. She later tells me that she's having an epidural in her shoulder. There's no epidural space in your shoulder. That's head epidural is only in the epidural space surrounding your spinal cord. But that's the same difference of when I ask a patient where they're having their injection and they come and they're saying I'm having an epidural, and they say, and I say, where? It could be cervical, thoracic, lumbar, sacral. Are we talking C2, C3? Are we talking L4, L5? Have an idea. Surely you've heard these terms before. You've been in and out of seeing these doctors for months. You've had this, horrible back pain. No, they never know. They never know. They literally say, well, it's in my back. I said, well, that's good because that's where the epidural space is located. But can you give me an idea of the, buttload of vertebral bodies you have back there? Is there any mere location? Is this a neck problem? So obviously she has shoulder pain because she's got, a disc issue in her neck or nerve issue in her neck that we're going to fix. The other thing I noticed on the phone yesterday is the TV's on so loud in the background of this patient's home, and I can't hear her at all. And then she's whispering on top of it. So then I say, I'm sorry, come again? Or can you repeat that? Or I can't hear. She never makes an attempt to raise her voice. She just continues to whisper on the phone. The TV's so loud, I can literally hear what they're saying on TV. So whoever's watching the morning show yesterday, this lady was talking about how much she admired this person that was on her show. I could hear the words. I couldn't hear the patient at all. It was actually the patient's wife, because the husband never knows what's going on with it. It's his wife that handles all of this. And remember, I used to think that, the man died of a broken heart when the woman died first. No, it's because she was in charge of all of his medications and he just quit taking them and then dropped dead. Yeah, it's turn the TV down when someone's on the phone. Like my husband, when I'm on the phone with him and he's like, I can't hear you. I'm like, well, I can hear your radio in your car. So turn that down and then maybe you can hear me. Do you not know how this works? Okay, so some stuff from students. I meant to bring, let me make a note to bring up that, I got to bring up the dry erase board, the little one. I'm not going to haul that thing over here. You gotta, some of these I gotta write down. I think just one or two, but I gotta write it down so you get the full gist of what it is when a student charts something so fabulous. Now these are some things that I printed out. Well, these are just really good EKGs. I'm not sure why they're in here, but I took a screenshot of this one. There's no information on it, just some words, and it said that the patient, unremarkable, only concern was something provided with necrotic therapy for pain. Necrotic therapy. I'm sure that's just a typo. Surely they meant narcotic therapy for pain, but the necrotic therapy, I thought, I wonder what that's like. Necrotic therapy. Just a typo, even still. Okay, so what did we leave off on? Oh, the student that charted that the patient denies feeling weak or pale. I don't feel pale. Do I look pale? I don't feel it. Right arm and leg grip strong. Leg grip. I guess that's when you put a pen in the back of your knee. You can grip it. I think that's the only thing that your leg can grip, but who knows? People are talented. I did have, and for those of you students, if you were there this day, I will never, ever forget this. A resident's daughter was in the room while we were doing, I think, wound care, whatever, and she started to tell me the whole story about how she's allergic to her own epinephrine. What would that look like in a fight or flight response? If you're allergic to your own epinephrine, when you get anxious, nervous, worried, upset, scared, or in pain, you bust out in hives? I don't know. I'd like to see that though. And I'm trying to keep a game face. All my students are in there and I can't really say anything. I just have to take it basically. And I did. I sure took it. History of GERDs. I guess that's multiple gastroesophageal reflux disease. Patient has peg placed at dressing. That's what it says. All I can tell you is this is what I wrote down from these students' papers. Patient has peg placed at dressing. That's all I got. Abdomen soft and flabby. Okay, listen. You little 20-year-olds, you think that your abdomen at 80 isn't going to be flabby? It happens. It happens before you even know it's happening. You cannot chart that. We're not here to chart muscle tone, texture, and integrity unless they're having some sort of like malignant hyperthermia crisis. Abdomen soft and flabby. How about with laxity, with skin laxity? Don't be calling people flabby. It hurts our feelings. Gastriostomy. I'm assuming they mean they had a G tube. Gastriostomy. It's very creative. History of malignant colon cancer ×2. Malignant colon cancer. Do you think, as opposed to her previous diagnoses of benign colon cancer? ×2. Okay. Skin fold area, or erythema to skin fold areas. Now, I don't know about you, but I have multiple skin fold areas. You're going to need to be a little more specific. Active range motion with right-sided paralysis. Okay, so I think what they mean is active range motion to left-sided extremities with right-sided flaccidity, secondary to paralysis, which would really be in the, additional history there that you put up there, but okay. History, oh yes, history of IDDM and hyperglycemia. So in turn, I believe what they're saying is the patient has insulin-dependent diabetes and is not very well controlled. You can't have hyper or hypoglycemia as a diagnosis with insulin-dependent diabetes. You can have poorly controlled insulin-dependent diabetes, like they eat too much or give themselves too much or give themselves insulin and then forget to eat. That's where those symptoms of hyper and hypoglycemia, or those instances of hyper and hypoglycemia, come in. But those aren't diagnoses. Those are symptoms of a cause, poor care of the diabetes. And sometimes not even poor care. Sometimes it's people are just very, very thready on it, and they're just so sensitive that bite of something jacks them up, and a few units drops them too low. I've seen it. So but you have to know what you're charting. +1 non-pitting edema. That's not how edema works. You have trace edema, you have non-pitting edema, you have +1, +2, +3, +4, or brawny. But all of the pluses mean it's pitting. That's what the plus indicates, especially when you use the term pitting. But okay. student charted, was able to smile upon command. Smile! And the patient just smiled. Because that's what I would do. If someone commanded me to smile, I would clearly immediately smile. It's in my nature. Grips and pedals strong and equal. Totally normal, right? Oh, except that they're a bilateral AKA. Oopsies. There's no pedals there at all. But that's all right. Pass the range of motion with 45 degree stiffness. Are we judging the amount of stiffness we have? When you're using angles, that's like the angles of how much a joint will move. Like that would be 90 degrees, that would be like 60, that would be 30. If they couldn't do 180, see the straight line, then that's where the degrees come in. I don't think you can really judge overall stiffness with a number, but all right. Facial droopiness to left facial area. It's this right here, the left facial area. Can you be more specific? No. And you don't really have to be. You would just say left side of the face, but that's okay. Or if it was significant in the, eye versus the mouth, which would be probably unlikely, but, be specific if you can. Oh, this patient had, I think, bilateral foot drop, and they charted that the pedals were strong and equal. Not entirely impossible, but if you have the foot drop, chances are your Achilles tendon isn't really working as it should, which means you can't completely extend and flex that pedal to create that motion. So I call BS. And then of course I go in there and she's like straight up, has that dorsal hump, toes pointed towards her TV at the foot of the bed. Yeah, that's speech dysphasic. Her speech is dysphasic. You can judge the patient as dysphasic, or you can assess the patient as being dysphasic, but their speech isn't dysphasic. They are dysphasic, and then their speech is either slurred, garbled, mumbles. You can say specific, but you can't necessarily chart it quite like that, but it's still good stuff. Impaired swallowing related to dysphagia. Impaired swallowing related to impaired swallowing. Now that obviously came from a care plan. That's not how that works. You can say impaired swallowing related to, I'm going to guess, a previous episode of loss of blood flow to the portion of the brain affecting swallowing or oral mechanisms, as evidenced by patient chokes or states, I have trouble swallowing, or, patient requests food cut into small pieces to make it easier for her to swallow. You have to have proof there. You can't say impaired swallowing related to impaired swallowing. Although I like that though. Impaired walking related to bilateral AKA. Again, no, you can't write that. You can say impaired walking related to, unless it's trauma, let's say, let's go far out there, related to years of uncontrolled insulin-dependent diabetes leading to poor perfusion. We're going to go all the way out there here. Chronic wounds resulting in bilateral amputations above the knee, as evidenced by patient requires prosthetics, a walker, and assist ×2 to ambulate to the bathroom. Right. So I'm assuming that, we can make anything up, but why they have it, the reason they have it is you're related to, and then the as evidenced by is watching them ambulate and say, what they're having a problem with. Oh, yes, the lactic hydrate 12% lotion for constipation. I'm sorry, we have a topical skin cream that helps with constipation? And if you know this cream, and if you work in long-term care facilities, everybody knows this cream, and you have to lather it in all these poor people because they are all dry skinned due to dehydration. Right. None of them are drinking. You pass your eyes, but you're not holding a spoon. You're not sitting them up and digging your fingernails into their little sternocleidomastoid to make sure they drink, to make you go away. You just put it by the bed, walk away, and then lather them with lotion in vain attempt to try to hydrate their skin externally, which never works. Diabetes stage 2. Oh, he's got the stage 2 diabetes. So sad. He was diagnosed with stage 2 diabetes. I'm assuming they mean type 2, but here's the thing with the types, and I've told you this before, and I see it forever in all the charts. I mean, every day I see this. I don't know that I'll ever understand the type 1 or type 2 or who decides that or what difference it makes because I'll see type 2 diabetes patient takes Novolog and Lantus. Okay, well, I thought type 2 meant that they weren't on insulin because the eye, as I learned it 100 years ago in school, that the eye, the type 1 in the eye reminded you that they're on insulin. Well, that's not true, right? So maybe type 1 means they were born with it, and type 2 means they developed it later when they gained, 60 pounds. Who cares? None of that matters. The only thing that matters are they or are they not on insulin? That's all that matters. You take a pill twice a day and you never check your sugar, how severe can your diabetes be? Now, you don't want to be taking those pills and not eating, of course, but those that are on insulin where they could inadvertently kill themselves with insulin, that matters. Are they or are they not insulin dependent diabetics? That's what you want to know. IDDM or NIDDM? Grips and pedals strong and scaly. That's just mean. No, they weren't talking about mine, but still, that's just mean. So that is some good stuff right there. I am going to stop it there and try to pick up next time. I got to stop at 15 minutes here because some people just don't have a attention span longer than that. So, and plus I have, as always, I have 100 things to do. I don't know how I worked full time and still got all of this done, or maybe my life just fell apart recently and don't even know it, but all right, we'll pick up there. And I'm sure I'll have other little stickies to add to the crazy stuff people say on a regular basis because it's just that exciting. But same as always, I got to get out of here. Forget your fears, face your fears, forget your failures, follow your faith. And I'll see you next time, if there is a next time. And still, no, first time's not the charmer this time. What if I hold it up there? You think that'll work? No? Oh, we're going to 17 minutes if I don't get, I'd just quit.